Okay, so now we're going to go on to Jana-Jade. So she's from Faculty of Health, and she's talking about the well-being of carers for the NDIS.
Right. My name is Jana-Jade Loadsman, and I want to thank every single person for coming to Praxis today, but also to all those people watching online. Big shout out to my kids in Cairns and also our son in Townsville, my two little girls here, who are my inspiration for everything that I do, to want to change the world, to doing uni, and God help me, now I'm about to finish my PhD. So hell yeah to everybody in this room, because we all know what a journey it is to get here. So give yourselves a huge clap. I think it's amazing. Yeah, go us. Go us. I'm an occupational therapist, I'm a mum, and I'm a carer. We have 3 daughters with disabilities, really complex disabilities, and also medical needs. And so, like I said, our girls and our journey through disability and complex medical conditions have inspired me to do our research. And my research, the wellbeing of carers engaging with the National Disability Insurance Scheme in rural areas, actually precedes my honours research. And I'm really proud of what we've been able to achieve and the research that we've encapsulated, which is we've had 1 research paper published, and so I was talking to somebody earlier, we've had 17 citations in 3 years, so I think that's outstanding for an honours research study. Yeah, huge. So here we go. This is my PhD, so I'm literally just weeks away from finishing. This has been 4 years, probably the longest 14 years of my life. Ask my husband, he'll agree. But yeah, here we are, we're nearly finished. So as we all know, the NDIS was, it's actually described as Australia's most significant social welfare policy since the introduction of Medicare. It has been a phenomenal change for all Australian carers. I'm not really sure if we could all say that it's been an incredibly positive change. I think it's been a really challenging change, having to learn a new system. We've lost a lot of supports that, the ADIC supports and different funding pools that were available to us, which suddenly disappeared when the NDIS rolled out. And I think one other thing that we all thought was that the NDIS was going to help every person with a disability who used to access these funds, but it didn't. The NDIS is currently supporting 550,000 people with a disability in Australia. The absolute number of people with a disability in Australia is actually 1 in 5 people. And so if you do those numbers, where, there's like 90% of people that actually aren't supported by the scheme, and with no supports remaining in community services, where do these people go? I'd really like to advocate for that, and I will be continuing to do that well into the future. To have some form of a disability, so it could be a psychological, physical, social, emotional, you could be age, you could have cancer, or some kind of health condition, and essentially under Australians' disability definition guidelines, you must have it for longer than 6 months for it to be considered a disability. Like my fellow primary Australians, we each play a pivotal role into the success of people with disability in this country. The stats are 2.65 million Australians are considered some form of a carer. 861,000 of those are primary carers. They care for 95% of Australia's total disability network. That is phenomenal numbers. If we're looking at 861,000 and providing care for what we know of the 550,000 people accessing NDIS, that is phenomenal numbers. Statistically, carers have some form of a disability themselves. They're also on the on the lowest income quintile out of any person in this whole country. They're actually below the lowest standard level of poverty, carers. And I think it's when we're really, really encapsulating, carers, I'm one of the out of the box. I'm a carer of 3 kids. I went to uni and I became educated. I didn't finish year 12 didn't finish year 12 and I stand here about to complete my PhD. You know why? Because I want better. I want better for this country. I want better for our children. I want better for our siblings, our parents, our loved ones. And I know that there's a lot of people who want better too. There's just some quick stats there. This is my family. And I think that, you know, we are important. We're not important to the bureaucrats that, you know, decide the different policies that we have to put into trying to somehow feed our family as well as, you know, go to work and get educated to want better for our kids. And I'm so lucky because, you know, my husband, Shane, thankfully supported me through this journey and we've sacrificed so much to get here. My kids who are watching, you know, Shane worked away for 7 years, so I could, as a one-income family, he worked in the mine, so I could go to uni. But other people don't have that opportunity. And so shout out to you, Shane. I love you, honey. Thank you for everything you've done to support me to get here. Australian carers save the Australian government $77 billion every single year. $77 billion, a cost saving that is reported to be so great that no insurance scheme could ever replace their replacement. They could never fund their replacement. The disparities, though, whilst we consider, you know, carers, it's like everybody talks about knowing someone with cancer, but let's start getting the message out there. Everybody knows someone who's a carer, or somebody who's got a carer, you know, a loved one with a disability. It's not just us, it's everybody, and it's almost like it's something that we're ashamed to say. And, you know, we're looking at historical, I know, you know, my husband, he had a disabled uncle, you know, back in the day, they were hidden. They never came out into society. So, and I think, you know, we're looking at the stats, 1 in 5. Like, you know, it's everywhere, and I think that we need to start appropriating it to be normal. You know, it's like disability is unseen. We see, you know, people with a broken arm. Oh, you broke your arm. You know, disability can be psychological, physical, social, emotional. So I hope I break the stigma around that. The success of Australian carers isn't just about individual factors such as income, race, sex, age. It's our communities, it's bureaucracy, it's everything, it's the education. You know, we're looking at this from so many different levels, and I think it's absolutely so important that we start identifying these factors. What's most concerning is, yes, you know, disability in metropolitan centres is not even close to the disparities that people in regional, rural and remote communities experience. You know, these are communities that have no access to, you know, timely healthcare services, let alone therapies and, you know, different things that are funded under the NDIS. People are waiting years for wheelchairs. God help us, we live in Cairns. Can't get anything up there. Anybody, you know, been to the far north and tried to get some even post delivered? You know, it's really considerably important that we raise, you know, these important issues, especially to all of us, because we can make a change. We've got the education, we've got the means to talk about this. My longitudinal pH research study is actually secondary data analysis that I was very lucky to be handed 18 months worth of research off John Hurley and his team. And he handed it to me and he said, Jana, do your best work. I'm not funded by any Australian government. I'm just, you know, funded by my own need to want better for our communities and our kids. So I conducted secondary data analysis and member checking. And so now we've got 4 years of incredible research for regional carers of the mid-north coast of New South Wales. We're very, very excited to have the research published. It's absolutely heartbreaking, some of the stories that I've read, some of the stories that I've heard, and I hope that I do my family's proud in being able to publish this research. There were so many things that stood out. You know, I had one mum that And so what my research actually found when I'm analysing the primary data sets was bureaucracy and intersectionality were the most phenomenal disparities for our families. And it wasn't just the NDIS, it was education, it was hospital and healthcare systems, it was transport, education, DCJ or child safety. It was everywhere. It was everywhere these people went. Centrelink, you know, of carers being kicked off because, you know, their loved ones had NDIS. Apparently they're not carers anymore. I've had carers threaten to have their children taken off them because their children couldn't attend school because they live in a rural area. The only time they could access therapies was during school hours. Yeah, I've had carers leave their NDIS planning meeting and their loved ones have gone home to commit suicide. These are real people's stories. It's phenomenal. And why aren't we talking about this more? It's like, you know, it's such a taboo subject. It's absolutely heartbreaking. You know, we talk about reasonable necessary supports under the NDIS, but to try and, you know, display the reasonable necessary need of your disability, you're talking to LAC, so local area coordinators, NDIS planners with absolutely no experience in disability whatsoever, and telling you that what you want isn't reasonable and necessary for your needs. I'm sorry, you know, it's like saying, you know, I just don't think you deserve that. I had one LAC tell one of my participants that she didn't get to go on holidays every year, so why should, you know, why should her son get to, why should they get to have that funding for the support? One of my mums here, I was actually going through these direct statements from my participants, and one of my mums said, you know, I haven't slept for 72 hours. My child has a schizophrenia and sleeps, and I can't sleep, he's going to kill me. Nobody will help me. Where do I go? You know, they do their planning meeting and, you know, parents and carers will sit there and say, I don't have family, I don't have friends, and everybody with a disability knows people don't want to deal with it. It ain't happening to them. And then they get the plan back saying, yep, neighbour looks after the kid all the time, grandparents, you know, come in and out, heaps of support, but it's like nobody's listening from the ground up. I had another lady who needed to go on a train to Sydney, so she lived on the mid-north coast to get some essential healthcare for her son, and the only wheelchair accessible part on that train was in first class. They would not let that child, that little boy who was 4 years old, in that first class train, even though it was the only disability accessible area on the whole train. They expected the mum to pick him up and carry him to a seat and, you know, store the wheelchair. These are, I know it's phenomenal, these are real stories, and they just go and go and go. I love, Craig asked me last night at dinner, he said, so what do you want to do with this, Jana? Where do you want this research to go? And I said, I'm going to Parliament and I need people to come with me. And I really do hope, and I won't stop, I really want to actually take this to United Nations, because when we look back at research policies, all of our sociological researchers out there, the Constitution of the World Health Organization 1946 states the health of the people must come first. Now, every single treaty that pertains to Australia's social health and welfare system pertains back to that Constitution. Let's go back to the policies, let's go back to the documents, and actually, as a community of regional, rural, remote, metropolitan carers, you know, siblings, loved ones, let's go back and design this better for the people so it works. I don't think paying support workers $65 an hour who just got an ABN and a bloody first aid certificate is actually reasonable or necessary. You know, let's go back and support the carers so they can actually feed their family and, you know, care for their loved one. I think Australia got it wrong. I actually believe it so much that I'm 14 years into research so I can get the letters, so I can get the papers, so I can get the papers published, so I can go to Parliament with the rest of, you know, the people that want to fight and say, you know what, we're here and we're ready, let's go. Yeah. I look so forward to publishing. Yeah. And I can't wait for you guys to come back and present these papers in full. So thank you so much for listening. Thank you.
Wow, thank you. That was really great. And thank you for sharing part of your story with us and sharing the stories of some other people. It's, I don't know, it makes it really meaningful. Thank you.
Thank you.
All right, so we've got a few questions. Anyone?
Probably a bit more of a statement, but in my, I'm doing Masters of Integrated Medicine at the moment, and one of the subjects, reviewing a lot of literature around burnout among carers and sort of percentages. And some of the percentages I was seeing in the research was, things like 50% of carers reporting needing more support, 30% of carers reporting foregoing their own meal to feed the person they're caring for. Again, percentages of like 50% experiencing depression, anxiety, and it's a really concerning problem, and it's really great work that you've done here, and I really hope that you do stomp the door of Parliament down and have you got some more people behind you? I've got a friend of mine who's also a colleague. She's a specialist clinical social worker. She's currently doing her PhD at Melbourne Uni. She'll finish next year, but she's doing it on, from memory, it's like psychosocial disabilities in the NDIS and the gaps in the policies and funding. But yeah, maybe she'd be another person. I know she loves a bit of a stomp, so. Yeah, I think you might both have be a bit of a force to be reckoned with, but it's really good stuff shedding light on this. And you're right, because we're putting a lot of funding into our support workers, and that's well and good. But there's only a percentage of time that these workers are there, and predominantly the people on the front line are the carers. Yeah, that's pretty much it. I didn't have any question, but yeah.
Did anyone else have a question? All right, cool. Well, I'll just quickly ask mine then. So if you could make one change now, what would you think the most important change would be that the government could make to kind of address the situation?
Redirecting, I don't know how they do it, but we've got the pension, carers pension. We need to somehow redirect the funding to carers to support them to survive. I think when we're looking from a ground point of view, our carers aren't surviving. The perpetual disparity, and I really honestly think that people will cite me in the future. We look at intergenerational trauma. Look at carers. They're perpetually stuck in disparity. There is no end for them. The siblings, when the siblings, I had one of my recent placements, the father, the carer was saying the father had suicide with his son because the father was dying of cancer. There's nobody who's going to look after him. We need to somehow direct this back to carers. I don't know, I feel like I need anybody social welfare, sociological people to extend together. Let's get our heads together. Yeah.
She's very hard to get contact on.
Nobody will say that about me too.
It's a PhD.
Hello. I don't have a question necessarily, but I just wanted to thank you for your talk. Congratulate you on persevering for so long. Did you say 14 years? Okay, and also to call out how empowering it is for your daughters to sit here and see you do that. I mean, that's incredible. And your husband as well. I think you said your husband is here, so that's incredible. You're welcome. Thank you.
All right, do we have any other questions? Yeah. All right, cool. Well, I think we'll leave it there then. Thank you so much.